Hi guys, welcome to Pink October. So worldwide, October has been set aside for breast cancer awareness. In Ghana in 2018, 100% increase in breast cancer cases according to research done by Global Can. Now, with the incidence of COVID and with limitations to hospital visits, especially for cancer patients, you can see how dire the situation is to preach about self-checks and early detection of the cancer. So if you're new, my name is Dorothy Dadib. I'm a community pharmacist here in Ghana. This is my channel. You are very welcome. From my already lovely MVP subscribers, thank you so much for your love. I really appreciate it. In this video, we are going to talk about breast cancer screening and what you can do to prevent it, especially here in Ghana. So some points to note: breast cancer does not only occur in older women. Of course, age is a risk factor. The older you get, the higher your chances of getting breast cancer. But nowadays, girls as young as 20 are getting breast cancer. Also, the fact that you have breast cancer doesn't mean your breast will be cut off. Early detection means early treatment, hence decrease the progression of the disease. So you get to save your breast. And men do get breast cancer, so men do have to get tested too. Okay, don't forget that. Adult women of all ages are encouraged to have a self breast exam at least once a month. So how do you do this, or why do you even do this? This is because, you know, when you do your breast exam, it helps you be familiar with how your breast feels, how it looks like, so then you'll be able to tell or determine when there's a change. We are going to show you how to do this in the shower. You use the 3 middle fingers to check the entire breast and armpit, passing down with light, medium and firm pressure, because when you are in the shower, because of water, it helps your fingers glide easily over your breast, so it helps you determine or feel everything better than when you are dry. Okay, and what do you check for? You check for a lump, check for a thickening of any part of your breast, check for a hardened knot or any breast changes. So in front of a mirror, you inspect your breast with your arms at your side. Raise your arms over your head too. So what are you looking for this time? You're looking for changes in the shape, you're looking for swelling, you're looking for dimpling, like a hole in the skin or like a sunken part of your skin. You're looking for changes in your nipples, whether it's oozing with any liquid, blood, anything at all. Okay, and then you lie down and then you place a pillow under your right shoulder and your right arm behind your head. So using your left hand, you move the parts of your finger, the middle parts or the flat part of your finger around your right breast, and then cover the entire breast area and armpit, and you do the same for your left breast. So far, I know some churches are having it, so find out from your church if you guys are, or they are having or providing free breast examination for the congregation, right? And then also Kolebu Teaching Hospital, 37 Hospital, Military Hospital and Leicester Hospital are providing free breast cancer screening throughout the month of October. So you could just pop in there and then up to have an examination done for you. I'm also told they have mammogram machines and they can do all that for you for free. So please don't miss out on this. If you are in Kumasi, the Breast Care International will be having free screening for all their peace and love hospitals, like for women in all their peace and love hospitals. So please do take advantage of this. So self-breast examination and mammograms are not the only way you can diagnose breast cancer. Sometimes you can use an ultrasound, and then sometimes you can do a biopsy where they take a part of the cancer cells or the cells of your breast to test if it's cancerous, right? So all these are included. So what puts me at risk of getting breast cancer? What puts anyone at risk of getting breast cancer? Age. So it is known that the older you get, the higher your risk of breast cancer. But it does not mean that if you're younger, you cannot get breast cancer. Also, genes. If your mom has it or someone in your family had it, it's likely that you could also get it. Not all the time, but then it is likely. Okay? And then also, if you have a child beyond the age or after the age of 30, it puts you at risk of getting breast cancer. It's just a risk. It doesn't mean it's certain. Also, if you don't breastfeed your child, or maybe you never had a child, so you never breastfed any child, it also puts you at risk of getting breast cancer. This is just to mention a few. So what can I do, or what part can I play in me preventing this from happening? First, you need to have a healthy lifestyle. So you minimize your drinking, reduce it or limit it to like a drink a day. You don't smoke or avoid smoking. You have a healthy weight balance. You also have regular checks. So self-breast examination once again plays a role. So the use of some oral contraceptives and the use of hormones for post-menopausal therapy also places you at risk of getting breast cancer. Talk to your doctor about the right oral contraceptive for you. So with the occurrence of COVID-19 and the limitation of hospital visits, I realized with my interaction from people in the pharmacy that some cancer patients sought out for other alternative medicines, meaning herbal medications, and some were using diet only for their cancer treatment and did not take what was originally given to them in the hospitals. Now, even if this might be good for you, you need to talk to your doctor, especially for drug interactions. I know talking about breast cancer is very scary, even for me. Like, even as a health professional, it is scary to think about it because it's like the possibility of something bad happening to you, but you do not want it to get bad. You need to catch it early to prevent it from getting bad. If you have a chance to prevent this by screening regularly, you owe yourself that. You owe your family members that. And even if you do screen early and you still do get the cancer, you owe yourself a fighting chance. Okay, you are not alone. You are not alone in this. There are people fighting with you and cheering you on. So this video should bring you hope and empowerment that you can get through this.